fraternity company today. Okay, there it is. I knew I should have pledged something. So Sam told me not to pledge. She had me around. Just kind of told me not to pledge. He told his fraternity or something? He told me not to pledge. You're alpha, right? Yeah. I was gonna pledge alpha then, but Sam said it wasn't no good. No. Sam doesn't know anything about fraternities, believe me. By the way, this is not planned. Unfortunately, my religious
Good afternoon, everybody.
And now, we bring you the following live press announcement from DC Mayor Muriel Bowser. Our regularly scheduled program will resume following the announcement.
Good afternoon, everybody. I'm Muriel Bowser. I'm the mayor of Washington, D.C., and I want to thank members of the press for joining us in our press room in the John A. Wilson building. I am joined today by Dr. LaQuandra Nesbitt, the Director of DC Health, Director Chris Rodriguez, the Director of DCH SEMA, Kevin Donahue, the City Administrator for the District of Columbia. Today, I'm going to provide updates regarding the latest DC Health guidance and Mayor's order. So let me, before I do that, take a look at our metrics, and you will notice today that they are all green or yellow, which means our cases, hospital capacity, the public health system capacity, and community engagement are all moving in the right direction. So I continue to thank DC residents and businesses for following our guidance and getting us to this point. We continue to have confidence in that those metrics are a positive indicator of where we are with the virus and the progress that we have made with vaccine. And let me just follow up on the announcement I made last week by saying beginning this Friday, excuse me, at 5 a.m., which is May 21st, restrictions on most public and commercial activity, including capacity limits, types of activities, and time restrictions will be lifted in Washington, D.C. And as many of you know by now, of course, at the end of last week, the CDC updated its mask guidance. So we have also updated our DC Health guidance to align with the CDC. And DC's updated mask guidance goes into effect today. Previously, before we had a vaccine, the best way to protect yourself was to wear a mask, social distance, and wash your hands frequently. Now, of course, your best protection is to be fully vaccinated. And we still want people, of course, to wash their hands frequently because it prevents the spread of all kinds of germs. So what it means for us beginning today is that fully vaccinated people only need to wear their mask or social distance in places where it is required. And the doctor can talk a little bit more about that. But of course, fully vaccinated people should continue to stay home and talk to their doctor if they're sick. And we want to remind people also that you are considered fully vaccinated 14 days after your final shot. So if you get one dose, it's 14 days after that, or if you get the 2-dose vaccine, it's 14 days after the second shot. So that said, if you are fully vaccinated, continue to take a mask with you when you leave your home. Then also respect signs at the places that you are visiting. If a business posts a sign indicating that masks are required, then you must follow their request for you to wear a mask, or they could deny you entry. We are making available on the coronavirus.dc.gov these signs. I know the business community will come up with their own signs as well. So a business may require you to have on a mask if that is their business's policy. And if you're not vaccinated or not yet fully vaccinated, we need you to continue to protect yourselves. First of all, if you're 12 or over, make a plan to get vaccinated, but also protect yourself and other people by continuing to wear your mask if you leave home. And for now, all people are still required to wear a mask in the following places: on the metro, on buses, and in taxis, also on an airplane or at a transportation hub such as an airport or train station, in schools and at child care facilities, healthcare settings, when required to per your workplace or establishment policies, in homeless shelters, in correctional facilities. And finally, in addition to the updated mask guidance and an updated guidance for fully vaccinated people, today we're also updating guidance on business operations, child care, summer camps, and schools. And all of those guidances will be posted on coronavirus.dc.gov/phase 2. So with that, we'll take a few questions. Yes, sir.
Mayor Bowser, what about churches, particularly churches with large congregations?
What about them?
Will they, after 5 a.m. on May 21st, will they be able to go and conduct services, of course, on Sunday?
Yes. So the churches, the restrictions on capacity, if that's what you're referring to, will be lifted. Yes.
Mayor, what are the plans for rec centers and pools this summer and or other activities for families? Will there be capacity limits?
There will not be capacity limits. Your question was
for
pools.
Rec centers, pools, things like that, yeah.
Right. So I don't anticipate any capacity limits at those locations.
Will you be jumping in this year?
I hadn't thought about that, Sam. I will say, thank you for asking about DC government facilities. I've asked the city administrator to consider what the DC government's mask policy will be for our facilities and our employees, because just like other employers, we are thinking about our employees coming back and working with members of the public. So the CA will communicate with all of our agency heads that we will require masks in the workplace and for our patrons until further notice. Yes.
So basically, I'm trying to get this straight. So basically, the CDC basically said masks are not required outdoors, and that masks are not required, I guess, indoors either. And so
For fully vaccinated people. But I'm going to let Dr. Nesbitt, ask Dr. Nesbitt, I should say, to answer any more questions about what the CDC has said.
Thank you, Madam Mayor. Last week, the CDC advised on a host of activities that fully vaccinated individuals could do, including the use of masks. The recommendation is that fully vaccinated individuals are not required or recommended to wear a mask indoors or outdoors, with the exception, the DC policy is with the exception of the places that the mayor has outlined. So our schools, child care facilities, our healthcare facilities, correctional facilities, and other non-congregate non-healthcare congregate settings, such as our homeless shelters. In terms of outdoors, unvaccinated individuals, unvaccinated meaning you haven't had any vaccines, partially vaccinated meaning you had one dose of a 2-dose series, you haven't finished it, or even if you've had both of your doses and you're still within that 14 days, are still recommended to wear masks in some outdoor situations. So if you are outdoors, as our capacity limits are being restricted, and you are not fully vaccinated, you should still wear a mask to protect yourself in crowded outdoor spaces. So when we talk about outdoor, we're still, for people who are not fully vaccinated, should still wear a mask outdoors with very few exceptions, 2 exceptions, when you're at a small gathering outdoors, or when you're mixing with with less than one household outdoors. Otherwise, if you're not fully vaccinated, you should think about just wearing a mask as a way of life until you are fully vaccinated.
what about churches? Again, the mayor said it's up to businesses, but what do you say to church congregations?
So what I say, not only to places of worship, but to every business and entity in the District of Columbia, is that when you have unvaccinated and fully vaccinated people in your space, whether it be indoor or outdoor, your risk of exposure and transmission to those unvaccinated individuals is higher. So I make no distinction at this point in terms of the places of worship, restaurants, large entertainment venues. If you have a mix of fully vaccinated and unvaccinated individuals, there is still a risk of transmission, particularly to those individuals who are unvaccinated.
Any other questions? Yes, sir.
The council is likely to extend your authority to keep the public health emergency in place until I think the end of July. Have you given any thoughts of whether you will keep it for that long and what benchmarks you're considering?
The mayor's order will also operationalize what the council has approved, so we will extend the public health emergency. And we're largely extending the public health emergency for, I would call it, administrative purposes, making sure that all the emergency funds available for the federal government we can still apply for and are still eligible for. There's certain hiring that we still have to do related to our response that the public health emergency allows us to do. Yes, ma'am.
Off-topic question. The fencing around Lafayette Park has been removed. I was wondering if you have any update on the fencing around the Capitol and any thoughts about the National Guard's official last day being Sunday. Should they remain? Should they leave?
I don't think I have anything to say right now about the fencing that remains at the Capitol. I am due for an update on what the Capitol's posture is. I will say that Director Rodriguez and I have had discussions with our nation's Homeland Security Secretary about the federal government posture. And so I expect that we're going to continue to work with them on how to move forward. Yes, sir.
2 quick questions, Mayor. Just for the point of clarification, as you know, on July the 4th, you have 2 local parades, the Barracks Road Parade and the Palisades Parade. The national parade has been canceled. Any sense on whether those parades are going to take place, or authorization for those?
I'm not sure, do we have a status on permit? I'm not sure that we have any permits in to us. But let me be clear, what we're saying is that we have lifted capacity limits on our commercial operations and large gatherings, and then you will see that in the mayor's order.
Okay, my second question is, this being Washington, D.C., some legal beagle may decide to challenge your order, particularly with businesses. I can't go in here because I don't have on a mask, and that's not fair, violation of X amendment. Is your team prepared for something like that?
Well, we're not ordering any business to require that their patrons or employees wear a mask. That would be a business decision. Our legal review says that the business has a right to do that. So if there's a cause of action, it would be between two private parties. We will, in the district, however, in our buildings, as I mentioned earlier, we are going to maintain a masking policy. Yes, sir.
Chairman Mendelson is considering or proposing rather I guess a rollback of the eviction moratorium. Correct me if I'm wrong, I believe your administration is supportive of that. It involves the Stay DC fund money.
I don't want to speak specifically about what he's proposed because I'm going to have to look at it. But my view is that we have over $300 million available for tenants in arrears, and we need them to go to stay.dc.gov to apply because they can get up to 15 months of their rent paid. And it's very important that they do go and sign up. And we also need people who have arrearages at Pepco and DC Water and Washington Gas to also sign up because those arrearages can also be supported at Stay DC. And it's even more important because we have to commit those funds in order to get the full benefit of the federal dollars. We have to commit those funds. We need people to apply, and we're going to ask them for a few documents, of course. It's very easy to upload them and get that rent taken care of. Does that answer your question?
Yes, it does.
Okay.
Sorry, there's been reporting that there are, I guess, some difficulties with the application process. Are you confident those can be smoothed out in time for the legislation?
I am confident, and like many things, people are being asked for some documents. They need to apply them. I understand from Deputy Mayor Falchicchio that there may have been some federal guidance that would change some of the things we have to ask for or ask both parties for, and we will do that. But just everybody, go to the website, read about what we need from you so that you can get these arrearages taken care of. Yes?
Thank you. As we're moving rapidly toward reopening, less masks, more crowded businesses, the metrics that show that the city is really doing much, much better on coronavirus cases. There have been some questions recently about those metrics. And I think we never really had an explanation last week.
You're talking about the cases that were late to be reported. Let me ask Dr. Nesbitt to talk about that.
Okay, thank you.
So when you say questions about metrics, I just want to make sure you're only referring to the backlog cases that we reported that impact the daily case rate.
Well, there were multiple days that there were new cases reported that were from previous days. There were days where no tests were reported, days where the number of tests that had supposedly been conducted actually went down. The tests
Sure.
had not been done.
So there were no days where no tests were reported, Julie, per our records. What we experienced was there's something essentially that exchanges all of the data that comes into the health department from a number of sources. This isn't just specific to COVID, but it's where our electronic lab reporting occurs. And there were some challenges with submitting high volumes of duplicate data that led the system to not have space to report for analysis certain cases. No data was ever lost. All of the cases, the positive cases, were actually reported. We've gone through a process to reconcile with the labs who report using electronic lab reporting. This occurred from the period of time for data that is publicly reported, May 8th to May 14th. Because of that, what you have is essentially 4 days where numbers were lower, artificially low, because of the need to go back and clean the data. And then you have 4 days where data was artificially high to compensate for those days where cases were not reported. That will cause us to have a inappropriately high daily case rate for the next several days, possibly through May 22nd. And the reason why that will be high is because the artificially low reported days happened earlier, the artificially high reported days happened later, and so that 7-day average that we use for daily case reporting, again, will likely be artificially high through May 22nd. In terms of the total number of tests that are published, this impacted positive tests as well as negative tests. So our total test number has to be reconciled. We prioritized reconciling the positive test, and we'll need to finish in the next day or so the process of reconciling the negative test, which impacts the total test number. That will have an impact potentially on the positivity rate in the district, making it probably lower than is currently reported.
So just to make sure I understand, this is a problem with the...
Thank you, Sam. Sam was going to answer you.
So this is a problem with the data coming from the labs that are...
No. There's potentially 3 points of failure. This had to do with the actual tool, for lack of a better word. I don't want to call it an application or a database, but it's sort of an engine or a tool that we use that brings data in from a number of disparate sources and prepares it for analytics. The data came into the source appropriately, but did not move the data forward for analysis by the DC Health team. And so now we're basically, there's a clog in the pipe, and we're unclogging that pipe.
And is this a tool that's built by the DC government?
It is not. It is not. It is a national tool that many organizations use, and we've used it at DC Health without challenge for more than 6 years.
And other than the negative test that you said you're still reconciling, are there still problems? Are we still going to get inconsistent numbers going forward?
Well, Julie, you will know from our 16 months together that there are no absolutes, right? So we do not currently anticipate that this will be an ongoing challenge. The cause has been identified, and now we're just reconciling the data.
Thank you.
Yes, ma'am. I have a question about parking and how that's started to become reinforced. You know, previously, before all of this, they had certain times of day where people could not park on the side of the road, like during rush hour and that kind of thing.
Mm-hmm.
And not like roads, for example, like Wisconsin Avenue Northwest, can get pretty clogged during the day. And right now, there's not, enforcement keeping people from staying on the side of the roads during those times.
Well, it is coming soon.
Yeah, do you have any idea when that's going to happen?
I do. I'm going to ask the city administrator because I'm not sure I have the dates on the top of my head to answer.
On June 1st, that enforcement will begin.
Okay.
So this is a reminder to get your credentials updated. Most of that can happen online. In some cases, you may need to go into a DMV, get your tags or vehicle registrations updated. You can do that online in most cases. In fewer cases, you have to go into the DMV, take your car through inspection. So not only when parking enforcement goes out to enforce about rush hour parking, they're also looking at your dead tag or your vehicle registration that's expired, and those tickets are unfriendly. Let me just put it that way. So please take care of your business. Yes, okay, I'll take one last round also with Julie, Sam, Mitch.
Okay. 2 questions, one about masks. I know it said in schools kids still need to wear masks. Do they need to wear masks at recess at sporting events outside of school?
Yes,
So outdoors, indoors, all masks.
yes.
Okay. And second, I know you're submitting your budget soon to the council. How does the revenue estimate change your outlook for the budget?
My outlook for the budget is positive. I think that we are going to be able to continue to do what we need to do to respond, provide relief in recovery, but also get the district back on its trajectory of growth. So I think this is going to be an important budget for how we come back from COVID.
And my question is,
Okay.
can you clarify the lack of capacity limits around pools, given that some young adults and kids may not be vaccinated?
I don't have to, what do you mean? Do I need to clarify it?
Well, I guess just more. I guess people aren't going to be masked in swimming pools, right? So the fact that you have unvaccinated kids, some too young to be vaccinated, and everybody there, what's the?
Well, we don't have we have some kids-only pools, Sam. So let me get back to with the city administrator and Parks and Recreation. There may be some times that are reserved for young people, but we haven't made that policy.
So at this point, it's everybody goes in the pool.
That's how it is. Everybody goes into the pool. We have some, kiddie pools that are mostly splash pads, but our pools, we don't have a kids-only pool. We may have some times that are reserved for kids currently, so let us take a look at that. Mitch?
Just some clarification on, I guess, the restrictions or lifting of the restrictions in bars and restaurants. Are the 6 feet apart for tables and no seating at the bars, like the actual bar, is that lifted or are those still?
That is lifted. And starting this Friday for bars and venues, other entertainment venues, they are at 50% capacity.
Yeah.
3 weeks later, they can their restrictions would be lifted.
Okay. And then one last question on unemployment insurance. There was some, a recent hearing, there was some concerns raised with the call center, call takers giving, I guess, inaccurate or perhaps conflicting information. I'm wondering if you're aware of that and do you have any response to that?
I got a chance to look a little bit at that hearing, and I'm going to schedule some time so I can look at the entire hearing, and I'll have something to say about it then. Okay, thank you, everybody.
Yeah, thank you very much.
We now return to our previously scheduled program, already in progress.